معاذ.
Hello, dear colleagues. Thank you very much for joining us today. Thank you, Dr. Moses, if you are around.
Yes, Dr. Shaikh. Thank you so much. Just a pleasure to join around and just wanted to come and say hi to you and say hi to everyone. And
Yeah.
thank you for all the support. And I wish academy grows up and we are all here. We are all working together for the best interest of the candidates. Wish you all the best.
Thank you. Thank you so much. If you will be with us for today's session, it will be great if you are not busy.
Yes, doctor, I'll be here for a while because I'm in a midst of a transit. Then I'll be just moving on.
Okay, okay.
Next
Take your time.
subsequence be here. Okay. All right, doctor. Best wishes. Thank you.
Thank you so much. Yes, Dr. Vikas, you are around?
Yeah.
Okay. So, okay, time is up, so we can take this case. Dr. Vikas will take the LCC, and Dr. Muhammad will take the communication scenario later on. So first we are going to start with the LCC case, and this is the case for Dr. Vikas. So now you have 5 minutes to see the case and prepare how you will proceed.
Okay.
14. Legal is, okay, so 13. I'm just saying, I feel like I've been thinking ahead this whole time because I've always known that this was gonna go our way, so I got to clean my shit out. A couple of things. And this is gonna be a movie. You know that, right? Eric, I'm gonna make a movie about this.
Yes, you are ready, Dr. Vikash?
Yes. Sorry, it was
Just to,
muted.
no problem. Just to tell you, this fever duration is 5 to 6 days. Okay, in this information given, it's 3 days, but actually it is, we will change to 5 to 6 days. Okay, and now you can start.
Hello,
Hello.
myself Dr. Vikas, one of the doctor in the clinic today. May I confirm your name and age, please?
Yes, doctor, I'm Priya and I'm 35 years old.
Yeah. Today we are here to discuss about your condition. I'll ask some question. Followed by that, I will examine you, and during that, I'll make some notes which will be highly confidential. Is it okay with you?
Yeah, doctor, thank you.
Yeah. As I got a letter from your GP saying that you are having this rise of body temperature and headache. So can you tell me more about that?
Yeah, doctor, it is for now 5 to 6 days I'm having fever, and it is associated with severe headache and also body aches. So it was started like 6 days ago. The fever is high grade, and it is continuous fever almost every time it's there. I'm taking paracetamol tablets so to get relief from it, but even then, after some time, it is coming back.
Okay. So is this fever and your headache both started together, or it has first fever has came and then this headache has started?
Yeah, it was the fever first and then the headache.
Okay. And was it the first time this sort of problem has started to you, or earlier also when you were having fever, the same sort of pain has started in your head?
No, fever can occur, doctor, anytime in my life previously also. But this combination of fever and headache, I feel it is the first time I'm having.
Okay. Okay, fine. Just wanted to ask, like, anything which make it better?
Yes, taking rest, I feel slightly better, despite I'm feeling like my body is drained. I have no energy, and taking paracetamol, it's giving me some relief.
Okay. Okay, fine. And this fever is there along with that you told about the headache. So this, like at that point of time, the fever started that time, any point, any body part you are having, like in ear or other part, any secretions or anything, have you noticed?
No, not at all.
Okay, 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 fine. And have you noticed, have you checked your temperature? How much was the temperature at that point in time, any time in the day, if you have checked?
I feel myself, doctor, it is a high grade temperature. Then it was checked at the GP clinic. He told me it
Okay.
is 39 degrees C.
Okay. And this fever is coming, is it coming with chills, like you feel chills or something like that, or it is just fever is coming, is there and along with the headache?
No, it is with chills, doctor. It is lot of chills I'm feeling. And when the fever is just subsiding, I'm having some sweating also.
Okay. Okay, fine. And how frequently you are getting fever?
It's almost all the time present, doctor, for last 5 days.
Okay.
Paracetamol is giving me some relief for a few hours time.
Okay. Okay. Okay, fine. And as you said that you are having with fever, the headache is there. So headache at present point of time, how much is the intensity of pain if you say me so?
It
Out
is
of
7
10.
to 8. It is 7 to 8 over 10. It is severe headache.
Okay. Okay. Would you like to take some tablet at this point of time?
Yeah, please, doctor, if you can.
I'll just ask my sister staff nurse to give you the tablet and we can proceed further if you are okay. So,
Yeah, thank you.
okay. And fine. This headache is there. That is like it is when the fever is there at that point of time, it is coming, or it is throughout the day, it is also there lasting with it.
Yeah, it is also present all over the day, doctor.
Okay. And if I say like, what is the nature of pain? Can you tell me?
It is just type of gripping in on my head, doctor, especially the forehead area is affected.
Yeah. And the headache, it is first time or earlier also in the life you have this headache sort of thing?
No, it is not that type of headache, doctor. I'm known case of migraine. The migraine, I know this is half of my head having the headache, but this is the forehead area I'm having the headache, and it is
Okay.
just like a gripping.
Okay. So for migraine, you are taking your tablet regularly?
Once it is coming, doctor, only once in a month or twice in a month. Otherwise, migraine is not affecting so much to me.
Okay. And is it this time this headache is coming along with that you are seeing some eye, like some discharge from eye or some from nose, anything you have noticed?
No,
Okay. Okay, fine. And nowadays, when you are when you are having this headache, when if you are bending forward or like sneezing or coughing, at that time, this intensity of pain is increasing, or you feel like any throwing up?
no.
Okay. Okay, fine. And anything which makes like which you takes to decrease this headache?
The paracetamol.
Okay. And it is after taking paracetamol, fever, and this both is decreasing at the same time, am I right?
Yeah, they're decreasing. Yes.
Okay. And any history of you are having any trauma or any accident or anything in recent past?
No,
Okay. Okay, fine. And any history of you are having any pain anywhere else in the body part?
what? Sorry, what you're asking?
You are having as headache, is there along with that any other body part you are having pain or ache, anything there?
Yeah, doctor. I'm having muscle pain.
Okay.
All over my body, I'm having muscle pain.
Okay. Okay, fine. Okay, fine. And have you
Especially my
noticed?
leg,
Yeah. Yes,
especially
where?
my legs and the arms
Okay.
and the back area.
Okay. And since when this pain is there?
Yeah, in the muscles, in
Since
my
same time
muscles.
is it there? Same time is it there?
Yeah.
Okay. Okay. Okay, fine. And have you noticed any weight changes recent past?
No,
Any lump bump in the body?
no,
Any bowel changes, like any like your bowel, any changes are there, like hard stool, loose stool, anything?
no. But I feel like I'm having feeling sickness, and my appetite
Sickness,
is lost completely in last 3 days.
appetite, 3 days. Okay. And have you feel like when you go to sunlight or something, it is like it is hurting you so much or something like that, or bright light is for hurting you so much?
No,
And how is your water work?
water work is decreased, doctor, in last 2 to 3 days because I'm not taking anything in good amounts.
Okay. Any color changes have you noticed for your
Slightly
water work?
darker, slightly darker
Oh,
water work.
okay. And any skin rash or skin changes have you noticed recent past?
Yeah, I noticed some rashes developed yesterday, doctor, in my body.
Can I see the rashes?
Okay.
Okay. And any soreness, anything is there anywhere part in the body?
Okay. So these are the rashes she's having.
Okay. Okay. Okay, fine. Okay, fine. I just want to, yeah. Then I just wanted to ask, like, any soreness anywhere in other part of the body have you noticed?
No,
Okay. Any eye changes? Anybody told that you are looking paler than before?
no,
Any cough?
yes. I have dry
Since
cough and difficulty in breathing.
any like, okay, fine. Since when this dry cough and difficulty in breathing is there?
For three days now.
3 days. Okay, okay, fine. And like with cough, anytime that reddish sputum, anything has came?
No, it is dry cough.
Okay. Okay. Any swallowing difficulty?
No difficulty in swallowing.
Any shortness of breath have you noticed?
Yes, I'm having shortness of breath.
Okay, since when and what time it is, like on exertion or during the lying down, this shortness of breath is there, or all the time it is there?
It is only on walking and on exertion, and there is no difficulty in breathing while lying flat.
Okay, so this has started recently. Any pillow, extra pillow, anything you are not using, am I right?
No, it is started
Any
3 days ago with the cough.
any tummy pain,
No,
tingling, numbness anywhere,
no,
weakness anywhere part of the body,
no,
any allergy to any
no,
medication, anything? Past history of
no.
any significance which I should know, like blood pressure, sugar, or anything?
Only migraine, doctor, and it is mostly it is coming once in a month or twice in a month.
Okay, okay, fine. Any illicit drug history is there? I'm sorry to ask that.
No,
Okay, and any medication list?
Only I take brufen or paracetamol with metoclopramide when the migraine is coming. Other than this, I'm
And
not
how-
taking any medicine.
How frequently you are using brufen and metoclopramide?
Once in a month or twice in a month.
Any family history of significance a similar sort of problem?
No,
Have you come in contact with any sick person in recent past?
no,
Do you smoke?
no.
Alcohol? Do you take alcohol?
Over the weekend, 1 or 2 units.
Okay. What is your job? What you do as a daily living?
I'm a school teacher, doctor, and I could not go to the school for last 4 days now.
I can understand you are very sick. So at this point of time, it would be better that you are taking rest and we'll start your medication. I just wanted to ask certain personal questions. Are you having any long-term partner?
Yeah, living with my husband, doctor.
Okay. And how is your relationship?
It's okay.
Any pregnancy in recent past?
No,
Okay. Any loss of pregnancy earlier?
no,
Any pills, anything you are taking in regular?
yeah, I take OCPs, doctor.
Okay. At this point of time, I would like to stop your OCPs and we'll see when we can start and what best we can do for you.
Okay.
I'll send you to them. Any at this point of time, I just wanted to examine you. Is it okay with you?
Yeah, please go ahead.
Just I wanted to say the hand, any hand changes are there on the palmar aspect and dorsal aspect, along with look for the nail changes.
Okay. General appearance of the patient. Patient is looking just like exhausted, fatigue patient. Okay.
Okay.
And look, the skin looks dry.
Okay.
Okay. What else you want to see in the hands? No clubbing, no cyanosis.
Then after that, I would like to examine the pulse over here.
Pulse is 120 beats per minute. Blood pressure is 80/55.
80/55. Okay. Any changes in lying down and standing blood pressure?
No.
Okay, fine. Then after that, I would like to check for pronotal drift over here.
Okay, it's normal. Nothing, no weakness.
Then I want to check the eye. Any eye changes are there, like any redness or any color changes in the eye or any visual acuity changes is there?
No, no changes in the eyes.
Would like to check for the visual acuity and the field of vision in this patient and like to offer fundoscopy.
Okay, not needed.
Followed by that, I would like to check the oral changes, any rash or any ulcer, or any changes in the mouth cavity.
Only the mouth cavity looks dry.
Dry. Okay.
Yeah.
Fine. Then after that, I would like to examine for the lymph node here.
No lymphadenopathy.
Okay. Then after that, I would like to check for that ulcer, which whether I just want to examine that ulcer particularly and ask here one question that any recent past travel history is there?
Yes, 10 days ago, I visited to one of the forest area.
Okay.
2 minutes
And
to Delhi.
okay. And have you been well protected over there and have you stayed in the hotel or any other place or outside camping done?
Yeah, it was outside camping done, and it was a very nice garden or green areas we were there, and having the
Okay.
good time with the doctor.
Have you been like any bitten by any bug or any other insects over there?
I don't know, doctor, but I see this one black spot
Yes.
in my leg.
Okay. This is only one place. Any other place also it is there?
This is the only one place, and otherwise in my body, chest area and the abdomen area, she's having just like a maculopapular rash.
Okay, fine. Then after that, I would like to examine for the tummy for any organomegaly.
No organomegaly.
Then I would like to ask the patient to walk and ask any concern you have.
Yes, doctor, what is wrong with me?
See, I have taken history and I'm examining you on the basis of that. There are certain possibility in my mind. One is that you have recent travel history that would lead to certain infection, bug infection. And the second is that might be because you would have been like bitten by some bug over there, like some insect over there that would have lead to certain infection to you. And that could be one possibility in your case. We'll evaluate and we'll help you out in that context. Any other concern you have?
Okay, so what you will do for me, doctor, now?
First, I will, as your problem is very high, so I would offer you to join the hospital, and I will immediately start you IV borderline and start the IV fluid here and secure your condition first. And then I will involve the multidisciplinary team, including a specialist doctor like infection control team. And followed by that, we will start the antibiotic or the treatment according to your reports immediately. Any other concern you have?
Okay, doctor, I'm having a lot of weakness in my body. Will I recover completely from this disease?
See, at this point of time, it is we are not clear that whether how much recovery will be there. But with the start of the treatment, definitely you will get some betterment. And once disease is clearly in our hand, we get to know, then we will able to say you exactly how is the condition and how much recovery will be there. Any other concern you have?
Is there any treatment for it, doctor?
Yeah, as there is infection, it looks like certain infection. So first we will do the test, and then depending on the reports, we can start you medication. Most likely it will recover. How much it will recover, we cannot say.
Right. Okay. So how many days you want me to be admitted in the hospital?
It's tough to say right now how many days will keep you, as this infection is looking, it has gone to your head part also, brain part, and it is so we will just like depending on the condition and depending on recovery, we can able to say how many days it will take, but definitely it will take more than a week.
Is there any long-term bad effects of this disease, doctor?
Definitely your concern is very valid, as it's this bug infection. What has happened to you, it has gone to your brain area also. So there is a possibility that after recovery also there should be some problem would persist in your case. But it is very early to say right now what will be there.
Okay, thank you. Time is up.
If time allows, I'd like to check for the neck sign over here.
Yeah, this was the missing thing. I think other things also something else. I will give you the feedback. Let us start the examiner's question first. So what is your first, just summarize the case, please.
I have taken history this patient who is having recent travel history, and he is having fever since recent travel history 10 days ago and has having fever since 5 days. And that is along with fever, he is having high intensity pain is there, and there is insect bite marks is there on the lower limb. And along with that, there is BP is on lower side and his skin target is low. And the patient is looking very dehydrated state, along with the infective pattern looks like mostly some bug infection which has gone to the brain.
Okay, so what is your differentials?
First, I can suspect meningitis in this patient. Second is that some tick-borne infection which would have gone to the brain, and that causes this sort of infection. Third, I can suspect this is going to
two differentials only. Two differentials.
I can suspect some.
Okay. It's okay. So how you will investigate this patient?
First, I will do the baseline blood test like CBC, ESR, and CRP, and renal function test here and a liver function test also. Followed by that, I will do the specific test like that. I will do the brain scanning here, like MRI of the brain I will do, and followed by that, if things are not clear, I can go for the lumbar puncture study to look for the CSF study.
Right. Any other investigation related to insect bite?
Yeah, that rickettsial antigen I can check for, or antigen for fever profile I will do in this patient to look for infection pathology to find.
Right. How you will manage this patient?
First, I will educate and counsel regarding to the patient regarding his condition, and immediately I will put a 2 wide bore cannula and start the IV fluid in this patient. Followed by that, I will form a multidisciplinary team and team of doctors, including the infection control team and brain specialists. Also, I'll involve along with GP on board, and we will start with the treatment according to the infection protocol of particular area.
Okay. To where you will admit this patient?
I'll admit this patient in the infection control department in ICU,
Right.
under ICU.
Okay. So, any long-term complications you know about this disease?
This patient can have as headache is there, along with that he can have some neurological abnormality post sequelae can occur to the patient. Along with that patient can have confusion or long-term debilitating symptoms can also come in this patient.
Okay. What about the prognosis?
Prognosis of meningitis can be as it looks like it has gone to the brain. So prognosis will be bad in this patient as the disease has progressed very fast. So, but with the treatment and with immediate on-time treatment and management, the recovery can be there. But current point of time, it is tough to say how much recovery will be there in this patient.
Right. Okay. See again this picture.
It is rickettsial something.
Yeah.
So that will lead to the inflammation around the brain. So usually it is caused by, so mostly we'll start the antibiotic, and
What antibiotics?
doxycycline it have good role in this patient.
Yes. Doxycycline. What is alternate to doxycycline?
Third generation cephalosporin.
Azithromycin. Okay. So yesterday came this case in India. Okay. Dr. Vikash?
Yeah.
This case came yesterday in India. Okay. And the diagnosis is Scrub Typhus in this patient. Okay.
Okay.
And how it occurs? Okay, before going to the diagnosis, let me summarize your performance, and I will give you the feedback. During the history, whenever we have the fever like this patient, we have to search where is the focus of infection from head to toe. Try to find out the focus, where is the focus of infection. So here you suspected that the patient is having headache. So might be the patient is having meningitis. Meningitis is one of the complications of scrub typhus, but many fever comes with headache. Like fever with headache, what are the cases which can come with a fever with headache? Any idea?
Fever with headache, it can come. Ear infection also can lead to the fever, and that will be headache. That local and real ear and tooth infections, and along with that, a patient would have, if any trauma, that could lead to the infection.
Okay.
Subarachnoid hemorrhage can also lead to the infection to that patient.
Wait. I will rephrase the question now. Fever, headache, and myalgia.
Fever, headache, myalgia, vasculitis can also be there.
Huh?
Vasculitis can also be have fever, headache, and myalgia.
High-grade fever. High-grade fever
Yeah.
with chills.
High-grade fever, then it can be
with
dengue.
headache.
Can also be dengue can also be there in this patient. Dengue shock
Yes.
syndrome can also be there in patient.
Dengue fever, yes. Dengue fever.
Dengue,
Okay.
malaria
And
can also, because it is
malaria, yeah, cerebral malaria can also be
yeah.
there. So
And
these
then
should be
sometimes HIV
differential.
induced also it can be there, but there the temperature will be low grade.
In which temperature will be low grade?
HIV.
In which case?
HIV induced
HIV. No,
encephalitis.
it is short history of 5 days. Okay, think about the short history of infections. Okay, 5 days, 6 days. Okay, So fever with headache and myalgia, we have to think about some parasitic infection, okay, or viral infections. These are the two top of the differentials in the groups. Then under this heading, we have different types of infections. Now we will include another thing, fever with headache, myalgia, and the skin rash. And the typical skin rash like this, and the rash like this. Then the differential will change, okay? You have to include the scrub typhus, you have to include the rickettsial type of infections, okay?
So it can lead to the meningitis encephalitis or ADEM, acute disseminated
Yes.
encephalomyelitis.
You see,
because
the
of rickets.
headache can be part of the symptoms, as a part of the symptoms can occur in this patient, in the scrub typhus. In dengue also, we are not doing the lumbar puncture in these cases, okay? Because they are not causing typical meningitis. But in scrub typhus, patient can have the complications in the form of meningitis, yes. So how to ask about the meningitis? Do you have any neck stiffness? This is the question that you have to ask.
Yeah.
Okay, and during your examination, you have to check the neck stiffness is there or no, and then you have to see the leg test also you have to do. Okay, turning signs you have to check, right? Okay, so during the examination, did you check the temperature of this patient?
No, I asked them this.
Yeah, you asked during the history.
Yes.
When you are checking the vitals of this patient, and I told you the heart rate is 120 and the blood pressure on the lower side. So the patient presented with the high-grade fever, you should inform that I want to check the temperature now. Okay. Together with this, his patient is telling I am having difficulty in breathing and dry cough. So did you check the respiratory rate and saturation? And did you auscultate this patient?
Time was not there. So
No,
many
no. The time was not the matter in this case. When you are checking the vitals, the first thing you have to see the complete vitals in this patient.
Yes.
Okay. Time was there, but you have to utilize the time in a smart way. Okay. You have to do the targeted exam. And targeted exam means you have to do the case related exam. Okay. So in this patient, the patient having deranged vitals. So you have to take the complete vitals because you have to decide where you want to admit this patient. Isn't it?
Yes.
And you have to focus what are the complaints of this patient. Those areas will be the important areas for examination. Okay. So headache is there. So you should check the neck stiffness. Then you have to check the chronic signs. You have to see whether it is really a meningitis or not. Then visual acuity, visual field is acceptable. Okay. Once it is normal, then you should go to the lymph nodes. Okay. Then you should go to the chest. Okay. And the chest, they can present with pneumonitis. They can present with pneumonitis like an ammonia patient. They can go into ARDS as a complication of this disease. They can present with chest pain. You have to ask about the chest pain. And the chest pain can be because of the myocarditis and pericarditis. These are the complications of this scrub typhus. So, having said that, these are the important points that were there in the history and examination of this patient. About the investigation, the baseline investigations are good from your side. You have to see the complete blood cell count, ESR, CRP, liver functions, and the kidney functions, okay, as a baseline. Specific test for this, do you know, for this disease? Any specific test?
Rickettsial antigen test we can do.
Okay, it is not coming under the heading of rickettsia. It is scrub typhus. It is the typhus disease, and we have to do, if there is a specific test known as scrub typhus IgM ELISA test.
Okay, ELISA.
Yeah, this is the confirmatory test for this. Okay, and there is gold standard, that is the wheel phalanx test for IFL or IFL, but ELISA is widely used. Okay, so most confirmatory test is ELISA test, and we have to check the IgM. IgM is the first antibody that is produced after getting such type of infection. Clear?
Yes.
And then the management is because this patient is having deranged vital, so this is just like a medical emergency. You have to take this patient with the ABC approach, airway, breathing, circulation, and then you have to admit this patient to intensive care unit or high dependency unit. Okay, and you will start with the airway. Okay, so you have to check the saturation. That is very important in this patient. After checking the saturation, if the saturation is low, you have to start with the oxygen. Sometimes this patient, as I told you, that develop the pneumonitis and ARDS is a known complication. So sometimes the patient need high flow oxygen, non-invasive ventilation, or even intubation and mechanical ventilation also. IV fluid resuscitation with cautions, because these patients can develop myocarditis. So if you are giving too much IV fluid, the patient can develop pulmonary edema. Okay, so after giving the IV fluid, we have to monitor the patient, but the patient needs resuscitation, blood pressure on the lower side. But we have to be cautious giving the fluid. Vasopressors may be needed if the patient is developing septic shock. This is another complication of this disease. Okay, once you suspect this disease, and how to suspect this disease, so it depends on the, I will come to this geographical involvement. So it is common in Southeast Asia, in Eastern countries and Southeast Asia and Indian subcontinent. So that is why this case came yesterday in India in MRCP exam. Also, it is common in Pakistan area and also in other part of this world, okay, Southeast Asia. So once we suspect fever, body aches, headache, and these type of rashes, we have to search for Ishkar. What is Ishkar? Ishkar is this, this one is the black spot. You have to ask the patient, did you notice any skin changes? So any black spot or the skin changes, the patient will tell you two things. One is the black spot. This is known as Ishkar. Okay. And this is the entry area from where this larva is entering. It is not the mite is exactly, it is the larva that is causing the bite here. Okay. And where they are causing this problem, actually, whenever we are going towards the grassy area, the rainy season, grassy area, okay, so these are present over there. So the larva is just causing the insect bite, and after this is the entry point of this larva, and after entry point it is causing the maculopapular rash. So these are these type of the maculopapular rash. So this, don't confuse, in the rickettsia also the same black spot will be there, okay, but this is also known as a scar. But also in rickettsia, patient will have the maculopapular rash, okay. But these maculopapular rash in rickettsial diseases, they are starting on the limbs first, while in Scrub Typhus, they are starting on the chest and the abdomen first. So these are the differentiating features. And the other differentiating features are the geographical area. Okay, I will come to this point about the geographical area after a while. Okay, so these are the things that we have to see in these type of patients. So coming back to the management, so we have to start the antibiotics, that is the doxycycline, and it is started empirically in these type of patients. Okay, and then after starting the antibiotics, if there is a pregnancy issue, then the alternative we have to use, that is azithromycin. Okay, otherwise doxycycline the first line treatment in these type of patients. Okay, so these are the important point in this case. So now we will go to the differential diagnosis. We have to keep the differential over here: fever, headache, and the rash. So the first differential should be like in our area. So we have to think about typhus group. Okay, we have the typhus group includes Rickettsia prowazekii, okay, and then the second typhus group is Scrub Typhus group, and the organism is known as Orantia sutsugmechi. Okay, the name is very difficult, but you have to search on the net, so you will find out the Orantia sutsugmechi, just like that. Okay, so this is the second type of differential, and the third one is a spotted fever group, that is Rocky Mountain spotted fever and the Mediterranean spotted fever. So there are different organisms that are causing this. So it is just like a new case now appearing in the exam. Might be because of the endemic areas, rainy seasons. If there is rainy season and some cases are reported, so they are bringing the case like this. Okay, so the candidates who are appearing in the exam, especially in India and Pakistan, they should be knowing about this case, and this is the recently coming case. Okay, so now I will focus on the geographical areas about this case. Okay, so the Scrub Typhus is common in Asia Pacific. In Asia Pacific, especially the Southeast Asia. Okay, while this spotted fever group, they are present globally, especially in the African countries, American countries. Okay, in that condition, they will give you the scenario like the somebody visited or travel towards the forest area. Okay, so the geographical is very important in making the differential. Okay, then the third type of typhus group, that is murine typhus. It is present worldwide, but it is urban areas. It is present in urban areas. Okay, so in this case, the patient given history that she traveled, okay, and this was the grassy area or greenery area she visited, and from there was some insect bite, and you have to ask retrospectively that there was any insect bite or no. If yes, is there any mark over there, any skin change over there where the insect bitten you? So we have to see that area. Okay, so these are the important points that we have to keep in our mind. Now, the final thing is, I would like to tell about the complication of this disease. So, when the patient is asking you, so is it a treatable condition? Yes, it is a treatable condition if it is diagnosed early and managed on time. Otherwise, it can lead to severe complication like pneumonia, meningitis, ARDS, acute kidney injury, septic shock, and multi-organ failure, and cardiac manifestation, as I told, myocarditis and arrhythmia can occur. Prognosis is excellent with prompt diagnosis, early diagnosis, and with the prompt treatment and early treatment. Most of the patients make the full recovery. Delay in the treatment, increasing the risk of severe complication and prolonged weaknesses or post-infection sequelae. Okay, so we have discussed about the management and the risk factors and the complications. Okay, so again, the risk factor I will highlight more. So the people who are traveling to the rural areas, doing hiking, camping, farming. So it can occur in the farmers also, if they are working in the farms, it can occur. So the job is very important. The travel history is very important. Okay. And anyone who is doing the outdoor activities in the endemic areas, especially in the Southeast Asia, especially the Indian subcontinent. So these are the important points. Non-pharmacological management, we have to inform adequate rest, hydration, and the dietitian review. Okay, so this is all about this case. If you have any question, you can ask now.
Thank you for getting the new case for us.
Yeah, I brought this case because this case came yesterday. So likely in coming week or so, it will be coming like that, or it will be coming with a differential. Sometimes they will give you the Scrub Typhus, and sometimes they will give you the dengue fever scenario. Okay, so we have to be cautious. Okay. Yes, doxycycline we have to give IV. IV is also available. If it is available, IV will be better choice. Same for the azithromycin. Ideally, we should give the doxycycline. Okay. So about the group, I will show you about our group. Okay. So please just see the contact number and contact me. So I will add you in the group. Someone is interested. The down one, the number on down, you can contact on both. The number down is missing 10. So it is just like 966593737 It should be 900. So just please send me a message. So yeah, here it is right. So here you can see the number. This is my number. So just send me a message. I will add you in the group, or I will send you the link on WhatsApp. Thank you very much. So now we will do the second case. That is also coming yesterday in India. And this will be done by Dr. Muhammad. Yes, Dr. Muhammad, you are ready?
Yeah, yes, ready. Welcome.
Okay, so this
Evening.
is your case.
Yeah.
Good evening. Good evening. So
Mm.
please, we'll start the timers now. Try to
Okay.
find out the hidden agendas and what could be the possible things as we used to discuss, right?
Okay.
And then we will
Okay.
do this.
Okay.
So differential diagnosis, Dr. Pooja, for this case, uh, there are two ways to make the differential in this patient. If there is fever, headache, and myalgia, we should think about the viral infections and the parasitic infections. So then the differential should be the dengue fever and the malaria more. But if the patient is having fever, myalgia, headache, and the rash, then we have to think about this scrub typhus, then other typhus diseases, and rickettsial infections. Yeah, recording of this session will be available because this is exceptional case. So we will, Lyme disease you can include also. Yes. So recording of this session will be available. I will make it arrange in my group. Welcome. So just to focus now to the next case. There is also important case came yesterday also.
Mm.
Can you send first case to the group so we can keep this practice?
Dr. Muhammad, have you noticed the case? You can take the screenshot, Dr. Muhammad.
Okay, just a few seconds. Okay.
Yeah, take the screenshot. Taken?
Yeah, it's okay. Thank you.
Okay, welcome.
Yeah. To this patient. Yes.
This was the case came yesterday, and they gave the fever and headache for 5 days. For 5 days. Here, by mistake, we wrote the 3 days. It is 5 days. Why they gave the 5 days? Because the 4th day of fever, the rashes appearing, maculopapular rashes are appearing 4th day or 5th day. They are appearing on the chest and the abdomen of the patient. Okay, and the entry point or the insect bite point, that is the black eschar. The name is known as eschar. Eschar is present from the day of insect bite. So initially, it is just like a insect bite type of thing. It will not be black. Once it is healing, then it will become blackish, reddish. Initially, it will be reddish, just like an insect bite, and then after 3 days, 4 days, 5 days, there will be a just like a scale formation, the black spot formation. So it means it is healing. Yes, you are ready, Dr. Muhammad.
Okay, I'm muted. Hello, good evening. My name is
Good
Dr.
evening.
Muhammad, one of the doctor in medical clinic today. Am I talking to Mr. Aaron, 6 years old?
Yes, doctor, I'm Arun and I'm 60 years old.
Yeah, Mr. Nice to meet you. Mr. Aaron, today we are here to discuss some issues related to your health. Is that okay?
Yeah, doctor.
Yeah, so before I proceed further, I would like to know how much you know about your health status.
Yes, doctor, actually, I'm noticing that in the last few weeks' time, I'm
Mhm.
having some lumpy swelling in my body.
Yeah.
And after that, I went to my GP
Mhm.
and I informed him that he knows also my case, actually. I have been diagnosed as a case of lung cancer, and they removed one part of my right lung where the tumor was there. So
Yeah.
it was 2 years ago. And
Yeah.
after having the surgery, they told me that you are a lucky person that the cancer was diagnosed at an earlier stage. And we
Mhm.
have
Mhm.
removed the cancer completely, and you are out of danger now. So
Mhm.
I lived these 2 to 3 years without any complication, without any symptoms.
Mhm.
But recently I noticed some lumpy swellings in different part of my body, and I'm
Mhm.
feeling now there's weakness in my leg, and I'm feeling now there is a difficulty in passing the water work, doctor.
Mhm. Mhm.
So the
Yeah.
GP has referred me to your clinic, and you people
Okay.
have done the some test, the imaging of my body. So I'm here
Mhm.
to know about my condition.
Yeah, I'm really sorry what happened to you, and I appreciate the knowledge you know about your health condition. Mr. Orange, as you have mentioned that before you have lung cancer already treated completely, as you have mentioned, am I right?
Yeah.
Yeah. And and you came with this presentation as you have been mentioned that there is weakness in both lower limb as well as there
Yeah.
is retention in urine, yes, and in urine. Am I right?
Yes. Yes.
Yeah,
Yes.
yeah. So based on those things, actually, we perform lab investigations, and including MRI or the image to your back.
Yeah.
Do you have any expectation what about could be the report of these images?
I don't know, doctor. I'm lost. I'm not thinking too much about it. There should be
Mm,
something, a treatable situation, I believe.
yeah, yeah. I'm really sorry to say that there is something concerning. These things actually is not as we hope.
Oh, what do you mean by that, doctor?
Yeah, it revealed that the cancer has been spread and involve the main cable of your back. That's why you have those symptoms.
Oh, doctor, are you sure what you're talking?
Yeah, yeah,
The
I'm really
surgeon
sorry.
told
I'm
me
really
that,
sorry to say this.
yeah, but the surgeon told me, doctor, that everything is finished and you are a lucky person.
Yeah, you are
Was
right.
he lying to me? Was he lying to me?
Mhm. Yeah, you are. No, he's not lying to you. Actually, he is right, and based on that, the surgery has been done. But in few cases, sometimes it might return back again, and that's what happened to your case. I'm really sorry. Sorry about you.
Oh, doctor, it returned back, but it
Yeah,
is
it
not in
returned.
that part of where it was started. Now I am not having any symptoms related to my chest.
Yeah, you are right. You are right, and I appreciate your concern. And I'm really sorry to what happened to you. But this is what happened actually.
So the cancer has returned back, doctor. How it's possible when they said that everything is done?
Yeah. It returned back actually and spread and evolved. As I have mentioned to you, the main cable in your back has been involved. So that's why you have those symptoms.
Oh, doctor. So
Mm.
is it something serious, or can be operated last time as you operated last time?
Yeah, I appreciate your concern. You know, Mr. Aaron, as well as the cancer, if it spread somewhere, difficult to be treated surgically. In such case, there is other options of management, but this is going to be decided by the cancer team.
Okay. So
Yeah.
what treatment you will give to me, doctor?
Yeah, there is a lot actually of treatment, but the treatment is going to be decided by the team. This team actually including the brain doctor and including the specialized nerve and others supportive staff, and they are going to give you the proper plan of management. This depends actually, but at the time being, as I have mentioned to you, that is spread and exert compression to the main cable in your back. So first you will need to relieve this obstruction which happen to your back and reduce those symptoms. So in such case, we are going to give you some medicines that which can relieve this exertion directly to the main cable and relieve these symptoms.
So
Are you
what you will
with
give me?
Yeah, there is a medicine will be given through the blood channels, and that
Yeah.
definitely will, that will relieve these obstructions for a while. And
Okay.
after that,
Yeah, thank you. My next concern is, doctor, will I be able to walk in future, doctor?
Yeah, but this is not the main treatment. Actually, we start to give these medicines and then refer to the surgeons. And maybe if there is no improvement too much, actually they are going to go for surgery. And surgery, that means to relieve this compression in your main cable also.
Okay, okay. So my question again, doctor, the same. Will I be
Mhm.
able to walk in future?
Yeah, this actually it depends. I'm really sorry to answer it's very difficult to give the straightforward answer for these questions, but it depends on so many things actually. It depends on the size of the that cancer exert compression to the back, and this for how long also. If it is something recent, then definitely it might be an undergone for the surgery as soon as possible. That will be improved definitely. Otherwise, it may be some permanent damage will happen. And even it is variable actually from person to person. So difficult to give the
And
clear cut answer to this question.
the water work, doctor? What about the water work? My urinary retention, the water work retention. Will I need this catheter forever?
Yeah, this actually also depends on this one. After the medicine, after the surgery, we are going to assess this one. We see if it is difficult to actually definitely. If it is difficult, maybe we need to be proceed with this cancer with this catheter. Sorry.
Okay, now, doctor, I'm thinking it is something serious and my tumor has been spread out. So it must be affecting my life expectancy. So how long I have in my life?
Actually, sorry, I appreciate your feeling, and I appreciate your concern at the same time also. But Mr. Aarons, this actually also different actually from people to people, and the diseases behave differently. Yeah.
Okay, 2 minutes remaining.
Yeah, disease behave differently, and there is no clear the answer for this question for how many days remain or how many months. But definitely, that as well as the cancer spread somewhere, that will eat the time of the days, sure. But difficult to give clear answer for these questions.
Okay.
Yeah.
1 minute and 30 seconds remaining.
Yeah, Mr. Arun, may I ask you some questions?
Yeah, please.
Yeah, do you smoke?
No, doctor, I stopped smoking 3 years
Yeah,
ago when diagnosed me as cancer.
yeah, that's good. Well, I appreciate it. Do you smoke? Do you drink alcohol?
No, doctor, only over the weekend sometime.
Yeah. What is your job?
Yes, just now I retired, doctor, from my job.
And with whom you are living?
Yeah, I'm living with my wife, doctor.
Does she work?
No, no, no. She's bedbound, doctor, actually.
Yeah, she is depend on you also. So in such case, we are going to refer you to the social worker and the occupational health. They can help you in this regard. Is that okay?
Okay.
So may I
Thank
know
you.
also at which floor you are living at home?
Yeah, it's ground floor, doctor. Mostly I'm living at my ground floor area.
Down floor. Okay. So I'm going to give you leaflets and brochures to read more about this. And if there is anything, you can contact us at any time. Do you have any other concern?
No, doctor.
Yeah. Okay.
10 seconds more.
Yeah.
You can
Okay.
summarize. If you
So
have time, you can summarize.
yeah. So can I summarize to you? Maybe it will take long. So this is you have been diagnosed with the cancer has been returned and involved your main cable, leading the symptom that you have, and definitely the condition is serious right now. We are going to give the emergent treatment just to relieve this obstruction, refer you to the surgeons, and then they will decide what kinds of treatment they are giving. At the same time, you need to be to be treated with other treatment options such as chemotherapy, radiotherapy. This will be decided by the cancer team.
Okay, thank you. Time is up.
Welcome.
Okay, so here the time is up, but I will raise some other question. You can answer, or anyone in the group can also answer.
Okay.
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 If the patient is asking you, who will look after me? Will I be a burden to my family? Will I need to go into a nursing home? So how to answer this?
Sorry, again, sorry.
Will I be a burden on my family? How to answer this?
I think we need to refer him to the social worker, the occupational health physician. They can help him because even his wife is bedbound and no help them at home. So definitely we need to refer them to the to the relevant authorities or specialized teams that can help them in this regard.
Okay, so here we have to involve the occupational therapist also and social workers also.
Yeah.
Okay, we have to say to the patient like this, these are the some most common and worrying questions that you are asking. So it's natural to be concerned about your independence and not wanting to be overwhelmed to your family. So the occupational therapist will assess your home situation, and they will provide you the equipments like ramps and the grabs and the rails and a wheelchair to make it safe for and accessible for you to move around. Okay. The social worker will work with you to arrange a care package with you, where carers come to your home to help with personal care and several times a day if needed. Okay. So will I need a Foley's catheter again for the long period of time? So this is the same question. How to answer? So you have to answer like this. This is really a concerning question and very important concern about this issue. The urinary retention is because the nerve cables are compressed. Okay, the nerve cables are compressed, and we hope that we will treat the tumor and the swelling will subside. The nerve functions will improve. Right now, we are placing the catheter to keep you safe and comfortable and to protect your kidneys also. Okay, but it is again, it is early to say whether we will need it permanent or no. So our urology team, the team who is a specialist in this type of situation, we will involve them. Okay, and the specialist nurses will be with you. They will work with you, and actually the time will tell us. There is no exact answer for this. I'm sorry for that. Okay, what about my bowels? So there could be like urinary retention. Patient can develop the bowel obstruction also, just like bowel functions is not normal. Okay, so might be retention over there also. This is something we anticipate, and we have a clear plan for this. So the nursing team and the doctors, they are expert in managing the neurogenic bowels or the bowel habits of you related to the nerve cables. So they know how to manage it. We will start the regular follow-up with them. Okay, this might we will involve to give you some medicines and some suppositories through your back channel. Okay, so this will be assessed. Don't feel alone. We are here to manage you, and it will be the multidisciplinary team of specialist doctors and the medical staff will take care of you. How will I move around? So this is at the heart of your independence. As I mentioned, the pressure of the spinal cord is significant. and regaining the full walking function is challenging. And it is early to say how much recovery will occur, but it is our top priority that we are going to give you some medicine to decrease the swelling over there from the spinal columns, from the nerve cables. And then if we need the surgery, we will involve the spinal surgeon. Spinal surgeon. It is not the brain doctor. It's the spinal surgeon we have to involve. Okay, so the first we will give the medicine like steroid, and then we will think about the radiotherapy, radiation treatment, radiotherapy. So, okay, so, and then after that, we will see whether it is giving you significant relief or no. If it is not giving the significant relief, the next option will be the surgeon. The spinal surgeon will come. Okay, he will assess and we'll see whether he can do something to decrease the tumor mass from there. Okay, so that will also be beneficial and will give you the positive result. It will remove the pressure from the nerve cables. Okay, and followed by, after that, the effect of the physiotherapy will make you able to walk. This is our target. But again, it is very difficult to say or early to say. Okay. So these are the concern of the patient. Different concerns. So this was the scenario actually of the patient who has been diagnosed before a cancer, and he has been treated, and they have declared that the patient is having the full recovery. So this is a classical case where the PACES communication is assessed. They test your ability to handle with a complex scenario, emotionally charged scenario, and you have to see the empathy and sympathy together with the honesty. You have to give the honest hope, and the clinical knowledge is applicable here. What the clinical knowledge in this case is applicable? So we have to think about the steroid, dexamethasone we have to give, number one, the multidisciplinary team approach, and number two. And the number three is the radiotherapy. You should, you can tell to him, Dr. Muhammad, that the multidisciplinary team will be having the different options, but it's still not decided. The multidisciplinary team will see you, will give you the best possible plan according to your disease and disease status and spread out of the tumor, how much it is spread out and what we can do. But the treatment option will include like the medicine therapy, radiation therapy, okay, and then the decompressive surgery, and then might be some cancer treatments known as chemotherapy, and some newer medications. Okay, so these are the different options. What options will be best for you? It will be decided by the multidisciplinary team. Clear?
Yeah, clear.
Together with this, if the disease is spread out and if it is not manageable, then we have to give you the treatment known as palliative care. Do you know about the palliative care? Palliative care is a holistic approach. It is the total care of the patient where we are treating the patient's symptoms, because the disease is not treatable. So we are not treating actually the disease, but we are treating everything, every complaint the patient is having. So this is known as the palliative care. Also palliative care, you have to touch here and you have to inform him that it is the total care or the holistic care where we will manage all your symptoms. Will I be in pain? No, you will not be in pain. We will control your pain at any cost. The patient will not remain painful in such type of situation when the patient is having any cancer or any advanced stage of disease. So the pain management team will be involved also. So keep it in mind. So other treatment that includes in the palliative care include the social care, social support, nutritional support, okay, symptoms management, and spiritual support, and the financial support. Everything is covered in the palliative care, and it is given by the specialist team again. That includes the Macmillan nurse and the specialized doctors according to your symptoms. Rehabilitation is crucial in your case. We will involve the physiotherapist and occupational therapist immediately to work on your leg strength, mobility, and this is our top target that we want to mobilize you if it is possible. But it depends on three factors actually. Number one is severity of the weakness before the treatment. This is the clinical knowledge that you have to keep in the mind. The pressure on the spinal cord from the tumor has caused this weakness, and the response of the treatment depends on three factors. Number one factor is the severity of the weakness before the treatment. how much severe was the weakness before the treatment? Was it of short duration or long duration? If it is of long duration, then it is difficult to be managed and you may not be coming back to the normal status of walking. This is number one factor. The second factor is how quickly we can start the treatment. So my target is to start the treatment as soon as possible, Mr. Aaron. Okay, this is the second factor. And the third factor is we have to see the response of the treatment, how the tumor is responding to the treatment. So these are the three important factors that will give us the idea or that will give us the outcome of your case. Okay.
What was the first one, doctor?
The first one is the severity of the weakness before starting the treatment.
Okay, thank you.
But he is having the spastic paraparesis, you know. So he's having the weakness of the both legs and he's having urinary retention. How long he is having this weakness? If it is long duration, especially if it is more than a week, then the nerve cables has been compressed for a significant period of time. They may not revert back to the normal status. This is the number one factor. The second factor is how quickly we can start the treatment. That is why we say spinal cord compression in especially in the cancer cases, it is the medical emergency. We have to give immediately the steroid dexamethasone through the blood channel. How quickly we are starting the treatment. And the third factor is how well the tumor is responding to the treatment. It is a serious situation. We have to inform him. A full recovery of walking can be challenging for us, but this is our target. Don't feel alone. Like this, we have to approach. Okay, so any other concern can come here in this scenario because this is the new scenario. So we can expect what expected concern can come. Yeah, another important question is patient is asking how the tumor came back. So for this, there are 2-3 options that we have to consider. The first option is before going for surgery, before going for removal of that primary tumor, might be it had been spread out because the tumor cells are microscopic cell, not visible. And in that scenario, the scenario will not be of 2 to 3 years. It will be scenario of 6 months or so. Okay, so we have to inform the patient that the primary tumor, that time when we diagnose this, okay, we have done some imaging for the primary tumor, the lung cancer, you can say, and we have done some workup to find out whether there is some spread out or no. At that time, there was no spread out found on that imaging. Okay, but that imaging cannot see the microscopic status of the cells, cancer cells that might have been spread out. This is one of the possibilities. Okay, and the second possibility is the reactivation of the tumor. But in reactivation of the tumor, there will be symptoms related to the chest. Wherever the primary tumor was there will be symptoms. The patient will have again the cough, productive cough and hemoptysis and the chest pain, whatever the symptoms were there. There should be some symptoms will be mentioning in the scenario or the patient will be giving you or the surrogate will be giving you in the scenario. So in that case, you can say that second possibility is reactivation of the tumor. And the third possibility might be you have some tumor somewhere else. We have to find out that also. Okay, the primary might be somewhere else, and now the metastasis is there in the spinous process or in the spinal cord. So these are the 3 possibilities. So you have to see what type the scenario they are giving the surrogate, what type they are giving you. And this is a limited information in the case that I'm mentioning here, and because this case came yesterday. So I hope it's clear now.
Thank you, Dr. Shaikh.
Yeah, it is very clear. Thank you. Dr. Shaikh, just I have a question, if possible.
Yeah, please.
Yeah, is it possible to mention that prednisolone, methylprednisolone, or no need to give this one because it's not given the scenario?
Yeah. No need to mention the medicine name. What you have to give, you have to give like there are different treatment options. Okay. Like some blood, some medicine that we can give you through the blood channel, and we have to give it as soon as possible. Yeah. Okay. He will not ask you the name of the medicine. If he asks you specific names, then you have to say this. This will be decided by the multidisciplinary team. Just I'm discussing with you the treatment options. The one option is medicine. The second option is radiotherapy. The third option is surgery. If the pressure is not removed, the fourth option is cancer treatment. The chemotherapy might be known as the palliative chemotherapy. Okay, so these are the options.
And regarding lasting power of attorney, need to touch this point also.
Yes, this is another
Or
hidden
this
agenda.
clear.
Yeah, we have to discuss this also.
Mm.
Lasting power of attorney and a living wish, because and the time period, how much time is remaining for him. This is again, you have to say to him, it is very difficult to give you the correct answer, but as the tumor is spread out, I'm sorry to tell you, I'm really very sorry to tell you, you have to use the words like this with sympathy and empathy, that it is in months, but not in years. Like this, you have to say. So according to the scenario, in this scenario, I can say it will be in months, not in weeks. It is not the scenario of weeks. Okay. In some scenario, you will see the scenario of the patient is like having some, I cannot exactly give you, it will be different from cases to cases. So if they are giving you scenario like the patient is bed bound or severely emaciated and nutritional status is also low, bed sores are there. So you will say in that scenario, it is in days or weeks. Okay. Not in months. Like this, we have to modify the duration like this, but we cannot give the exact duration. Why? Because the variation between patient to patient. Okay. And the disease status that is visible here, and something is not visible or not, we cannot screen out completely like this. Okay.
Doctor, what if the patient is asking what could you have done to prevent this cancer from coming back?
What we have done before?
If the patient is asking that, why didn't you do some screening and keep me on a follow-up to prevent this from happening to me?
Okay, so we have to see the scenario carefully. If it is mentioned that the cancer has been treated, okay, if the cancer has been treated and the doctor has decided that the cancer has been completely removed, so we have to trust on that, and we have to force on that point that it has been treated. Okay.
Okay.
This is a very important point, doctor, what you are asking. So what we have to see what is the information given. If the information given that cancer has been removed and the patient has been declared clear, so we have to focus on this point, and we have to just like force on this point that it was correct decision. Okay. And this is something happening to you, and it can happen to anyone. I'm sorry for that. This is one thing. And the second scenario may be the cancer has been removed and the patient advised follow-up, and the patient is not coming for the follow-up. So in that situation, we have to say that you were advised for the follow-up, but I'm sorry to tell you that you were not following. So this is related to not adherent to the plan. Clear?
Yes, clear.
We have to advocate whatever given in the scenario. If it is given like the doctors has decided and they told the tumor has been removed and you are free from the cancer, so we have to help our team. We have to advocate that decision. That at that time you were you have been declared cure, and it is not like the doctors are telling on wishes. No, doctors are telling on the basis of some imaging or some investigation, and on the basis of some medical grounds that are very strong grounds. So we have to advocate, we have to stress on that. I hope it's clear now.
Yes, doctor.
Okay, I will see now the questions. So what questions given in the chat? Dr. Ali is telling it's very early to comment. We will try support you. Yes, this is very right approach. Okay, what is the role of occupational therapist if he is retired? Occupational therapy is not related to occupation only, but the occupational therapist, they are going to whom of the patient, they are arranging the things, like they are applying some rails or some ramps in the room, in the house of the patient. They are changing modification in the home of the patient, in the routine of the patient, you can say. So the patient should not be paralyzed or dependent on the things. They want to make occupational therapists, they want to make the patient mobilize. Okay, and the same in the physiotherapy. Physiotherapy, what they are doing the physiotherapy. Occupational therapy and the physiotherapy, they are the two very big pillars in the health system of UK. OTPT, they say. In the short form, they say OTPT. So every case who are looking that the patient will be dependent on somewhere, any disease, any long-standing disease where the patient is looking to be dependent, they involve the OTPT, occupational therapist and physiotherapist. Similarly, if some patient is having swallowing difficulty, they say SALT team. Okay, speech assessment and language therapist will come, they will assess the swallowing ability of the patient. So occupational therapist is not only related to occupation, but it is the wide term they are using. Yeah. Okay, so it's not OT. OT is the occupational therapist. Occupational therapist will provide alternate arrangement. Yes, Dr. Vikas, you're right. Yes. What could have been done better to detect the spread of recurrence of the tumor? I answered this. At the time, the team has decided, and they found that there is no spread of the tumor, but the microscopically we cannot judge. This is the answer. Social services, Dr. Yaswant, social service and the specialist nurses will do the adjustment at home. Yes. Yes, I believe occupational therapists will only do, no, occupational therapists will do work at home also. Yes, Dr. Jaswant. LPA, lasting power of attorney, advance directive, and living wish, very important to discuss. Also, this is important thing when we have to inform the patient that if we are giving the palliative care, we have to inform him that we will manage you at from all approaches with dignified way. Okay, in dignified way, with a respectful way. Yeah, urinary retention point we have discussed. It can be, urinary retention can be reversible and can be not reversible. So again, it depends on the treatment response. Okay, if you have any question, you can ask again by the mic, or you can ask on the chat. 2 minutes more, then I will stop the meeting.
Sorry, just regarding occupational service and occupational physicians, difference.
Yeah, both are different. Occupational therapy is just like a non-doctor team. Okay, but they are medical staff. They are doing the diplomas over there, and they are doing just like courses. Okay, so these are the occupational therapists. Just like a physiotherapy courses, the physiotherapy team, the occupational therapist, they are a specialized team. And the occupational physician is a doctor who is just like doing the occupational clinic, employment clinic or employee clinic they are doing. Okay, so occupational team is occupational physician is different, and occupational therapy is different.
Okay, thank you. Thank you so much.
Welcome, welcome. Okay, thank you very much for joining us today. So there are two types of courses we are offering. One is 1:1 course, that is specific course with the mentor, and this one is group course. So there are two types of courses we are currently offering. So anyone interested can approach to the admin or to me. And if there is no more question, we will end the meeting here. Again, thank you very much for joining us today, and good night.
Thank you so much. Thank you.
Thank you.